So same thing we've spoken about in the previous video, the concept of relational motion. One thing stays still, one thing moves in relation to it. Patient active approaches. So we're going to assess the wrist, right? Crunch. Okay, most restriction there. Say most restriction here, right? So thenar portion, what is that? Is it yeah, it is the radius. There we go. See, sometimes you forget your anatomy as in accurate ways. So we position, we build some bind to it, but we don't want anything to jump. Now, again, the traditional thing for a patient active approach is I would have you try to bend your wrist. So push into the, yeah, and then let it go. Okay, so we see some movement. So if you're looking at my fingers, there's some movement happening. What I'm going to have you do is I want you to try to push your forearm into my hand and let it go. Okay, some movement. Possibly more comfortable?
Yeah.
Okay, now I want you to push your forearm into my hand. Nothing really. Okay, so essentially the net result didn't end up in the wrist. What I want you to try to do is bend your elbow. Good, and let it go. So if you bend your elbow, that opened the wrist more in the area that we're concerned about. I want you to try to straighten your elbow. Nothing. And I can't control it, it's too powerful.
Yeah.
Right? So that's wrong. But because I'm searching, I'm identifying it. So now it was bending your elbow that seemed to do the best. Bend your elbow again and let it go. And now there's no more distance for that to travel, right? So I've run out of steam, and how do I know? Well, that thing's a hard end feel. Yeah. Okay, so I assessed the wrist this way the first time. So there we go, looser, right? Okay, so it may not be visible, but should be more range of motion. In a palpatory sense, moves further. So again, having somebody work the joint actively that we're working on may not be the most appropriate, it may not be the most comfortable, but you can search through it. You search other activating approaches or other patient active areas so that you know it's the one's the most appropriate for your goal and probably the most comfortable. But you'll try it, it'll work a little bit, and then it will stop working, and then you search through it again, and then you identify the most appropriate, as opposed to saying, well, I stretched this muscle, therefore I must contract it. It's more about how the patient responds to it in the moment.